What is the grade for this traumatic liver injury? There are multiple deep linear branching hypodense lacerations involving the posterior segment of the right hepatic lobe, with associated large hypodense subcapsular parenchymal hematoma. There's no evidence of contrast blush or active bleeding. Before we give the answer, we'll overview all the different grades for liver injury in the traumatic setting. A grade 1 liver injury occurs when there is a laceration less than 1 centimeter of parenchymal depth. There may also be a subcapsular hematoma with less than 10% surface area. Here, in segment 7, there is a subcapsular hypodensity measuring approximately 6 millimeters in depth. It had 55 Hounsfield units in density, in keeping with the hematoma. There was no overlying rib fracture. This is consistent with a grade 1 liver injury. A grade 2 liver injury occurs when there is a laceration between 1 to 3 centimeters of parenchymal depth, that is less than 10 centimeters in length. There may also be a subcapsular hematoma with surface area between 10 and 50%. Going back to the same case, there's a grade 2 liver injury, as shown by this linear laceration extending into the parenchyma of segment 4. There's no intraparenchymal hematoma, no active bleeding. A grade 3 injury occurs when there is a laceration greater than 3 centimeters of parenchymal depth, and or a subcapsular hematoma greater than 50% surface area. A vascular injury with active bleeding contained within the liver parenchyma is also a qualifier. In this case, there are multiple deep hypodense lacerations involving the right hepatic lobe associated with a large subcapsular parenchymal hematoma. This was the case shown in the very beginning and is consistent with a grade 3 liver injury. A grade 4 liver injury occurs when there's laceration greater than 25 to 75% of a hepatic lobe or involves segments 1 through 3. A vascular injury with active bleeding breaching the liver parenchyma into the peritoneum is also a qualifier. In this case, there is a large laceration in the right hepatic lobe with a perihepatic hematoma. Active contrast extravasation from the liver parenchyma into the perihepatic space is also seen. Lastly, a grade 5 liver injury occurs when there's a laceration greater than 75% of a hepatic lobe, and or juxtahepatic venous injuries are present, i.e. into the retrohepatic vena cava or central major hepatic veins. In this last case, there's a grade 5 liver laceration with active bleeding and large volume hemoperitoneum. The laceration involves the left portal vein, left hepatic vein, and possibly the hepatic portion of the IVC. Leaked contrast is seen adjacent to the IVC. There's also a right adrenal hematoma, which is not evident on this slice. Now you know all the different grades for traumatic liver injury. Please subscribe for more awesome anatomy and radiology videos.